All right, it's time to talk with our featured guest, Dr. Bianca Adams. Bianca, how's it going?
It's good. How are you doing? How's it going?
I'm doing pretty good. Thanks for asking. Can you kick things off by telling us a bit about your practice, who you're
Yeah,
serving, and what are some of the unique things you're doing for your patients?
sure. We are located in Fayetteville, North Carolina, although we have a lot of patients that come from out of state to see us. We've been open about 11 months. It's a unique startup because I'm in an office with my dad, who's an oral surgeon. But when I decided I was coming to the area, we remodeled his office and made everything pretty and girly and very boutique-like. So we have chandeliers and custom scents and scented towels and like a comfort menu, the whole 9 yards. TVs on the ceiling and all of the fancy stuff for our patients. I really wanted to make sure when you came to our office that it felt like you were being an adult and adulting, but it was also like self-care. So it's like a little bit of a spa treatment, a little bit of you can catch up on your favorite show while like taking care of your oral health, because that's super important. And I really feel like your health is essentially self-care. So that's what I tell my patients. We have a lot of technology in our office, a lot of 3D printing. We have intraoral scanners, lasers. So we are definitely CBCT, Pano, everything is digital. So
Mhm.
we definitely are trying to keep up with the times. And when there's new technology, we're learning about it, seeing how we can implement it in our office. If it can save time or help with better clinical outcomes, then we definitely invest in technology for our patients.
Nice. Okay. So, did you decide to be in North Carolina for your startup because of your dad?
Yeah. So I'm actually a military brat. So I've lived a little bit of everywhere. I claim Atlanta is home because that's where I graduated from high school. And so when I go back, it's like a big reunion and I get to see all my friends that I grew up with. Actually, my senior year of high school, my parents moved back to North Carolina and they've been here since. So I've
Mhm.
moved around a lot, like in college and like before dental school and then even after dental school. And because he owns a space in a building, I was like, I know he's ready to get out of dentistry at some point. And so it made the most sense for me to come back to North Carolina. So it wasn't a bad move. It's a family business. We keep it all in the family here.
Nice. Okay. So then, if, let's just say, for example, your father sold it before
Yeah.
you decided to move, would you have still picked North Carolina?
I think especially when you're doing really hard things like startups and business ownership, like you need that support of your family. And I think it's hard to do when you're in a city where you may have friends, but friends are very different than like your family. Like sometimes we gotta kick those friends to the curb type thing, but your
Mhm.
family, if they really want you to be successful, they're willing to do whatever to help you. So I think that even if he sold it, I still would consider North Carolina. I may have gone back to Georgia, but I know that him being here, even if he sold, even if he retired, if I needed something, like I had his help.
So it's like a father mentor kind of a deal. Gotcha.
Yeah, it is.
Okay. Okay.
Yeah.
So then how does that work? If you don't mind me asking, like the agreement or clause with, was there anything like that? Or no, this is like, hey, I'm coming in
No.
here.
No, there's no agreement or clause. You just let me know when I can stay home and I can be done and I can go golf all day. Like, okay, so there's no like agreement or clause. He's been a dentist for like 40 years, maybe like a crazy amount of time. I can't even imagine. And so we're just working it out until he's like, I would think I'm ready to hang up my loops.
Interesting. Okay. So then you also mentioned it's good to have a support system throughout this time and that sometimes you kick those friends to the curb. What do you mean by that?
I think in different phases in life, people are in your life for a reason and a season. And so sometimes you can't keep those same relationships going or those same friends with you throughout your life. We hope when we become friends with people that they become our best friend, right? But as we get older and we start becoming more adults and hopefully developing that emotional maturity and intelligence, like you realize you have to find different friends to serve different purposes. And so in this space, most of my friends don't own their own practice. Most of them work for public health or they work for corporate, which is fine, but they don't quite understand the struggles that I have as a business owner. I have maybe one or two friends that do own their own practice. And one of them, we've just happened to be friends since we were like 15 or 16 years old. So a really long time. And she actually works with her dad as well. So when it comes to like family dynamics and it comes to frustration and it comes to like where are the patients? Why is everybody canceling? Like,
Yeah.
what's happening? She's the one person that I can go to that I know like fully understands the big picture. Because when you're an associate or when you work for a corporate office, you're like, well, it's not really my problem. I'm just here to treat the patients and get my check and go. But when you own your own, everything is different. Like you're counting every dollar, every cent, training staff, people are out sick. You worry about so much more and it's so much more difficult. So I think like really having those people that you can be transparent and say, hey, like I know that I posted on Instagram and it looks like on Instagram, like we are really killing it. Today was a really crappy day
Yeah.
and really hard and patients weren't nice and whatever the case may be. And so I think it's really important to have that support system.
Did it come to a point where you were like venting and they were more like, all you got to do is calm down? In your mind, you're like, that didn't help.
I actually was in Louisiana during the pandemic. And so that was like a hot spot. And I was a resident, and actually, our hospital ran out of oxygen and beds during the pandemic. I think life shifted during the pandemic. And I think that people started to realize who your real friends are and like who you can really lean on and count on and who you can't. So, I mean, it's all good. I have love for everyone, but there's just certain people that I know that I can be transparent, I can be honest with and open with. And people that I know that aren't going to just tell me it'll be fine, but they can say, okay, let's talk this out. Let's come up with a plan. Is there anything that I can do to like help you? Or do you need me to just listen? What is it that you need from me? And I think during this particular time, those are the relationships that I have fostered and I've become closer to.
You want them to ask you, do you need comfort or the solution right now?
Yeah.
And if it
Yeah.
is a solution, like something where you can relate to.
Correct.
Okay, interesting. So then your practice, you mentioned you work with an oral surgeon, which is your father, right?
Mhm.
How big is this location and how many operatories?
3 surgery rooms, and then I have 5 operatories. I have 2 hygiene, and then I have 3 just like doctor chairs that we can do hygiene out of if we need to. So I think we have a total of 7 or 8 operatories. We share like one sterilization area. We have 2 separate teams. So it's not divided. If you walked in the office, his logo's on one side of the desk and my logo's on the other side of the desk, but it's one office. So we kind of all mesh and try to hop in and help where we can.
Gotcha. Did you bring on any team members or
I
no?
did. I just hired a virtual assistant that I am in love with. She started yesterday. She's like reorganized my spreadsheet. She's like very, very on top of it. I'm like, love you. I should have hired you a long time ago. We have a virtual team member. We have a patient concierge who's at our front desk. Let's see, we have a sterilization tech. I have an intern that functions as a floater if I need her up front, if I need her to assist. And then I have a dental assistant. So that's my team. And then he has his own like separate team. So it's a lot of us buzzing about.
Gotcha. His own separate team. Do you ever talk to them and tell them like, hey, can you help me with this? Can you do this? Or how does that work? I know I'm pretty sure like on the surface level, maybe everybody's like respectable and respectful and things like that. But then I don't know, maybe it's like the office manager who's been there for 30 years is,
The office manager is my sister.
oh, okay.
She's going to give me a little bit of pushback, but it's fine because I'll be like, I'm going to go tell mom and you're going to help me anyway.
You're going to hear it. Yeah.
So, like, let's knock it off. We try to be pretty, like, independent and not be burdensome to each other. We try to be respectful and handle our business, but we do have to lean on each other and it's totally fine.
And so the team members mesh well together too. That's really good that you're able to
It's
find.
important for us. If we can't, you can't stay.
Has that happened?
Yeah.
Okay.
I wouldn't say that I'm meaner, but if you don't fit the vibe, if we see your true colors very early, you got to get out of here. If you are causing excess stress or frustration to the staff, if you're not showing up and giving it your all, if you're distracted, let's not waste time. We need help. We need a job that needs to get done. If you can't do it, that's fine. If this isn't the place for you, that's fine. Let's find somebody that wants to be here.
So then, if you don't mind me asking, what is the vibe?
Oral surgery is a little bit more serious, obviously, because they're dealing with sedated patients and he's military trained. So he's definitely like quieter, like, let's get in here, let's do the work, let's go home. I'm also very much, let's start on time, let's finish, and then let's go home. We play different types of music. Obviously, my patients are mainly awake. What music do you want to listen to today, Miss Jones? What do you want to watch on TV? How's your grandkids? How was whatever, whatever? We all like mesh and we have a good time. It's kind of a relaxing, kind of chill environment, unless it's a super crazy day where we're like overscheduled or we don't have enough staff, but it's pretty chill.
The person who doesn't fit the vibe, they interrupt that or
They can interrupt it or they don't contribute. Everybody here, we understand we have to help one another. So if you are unwilling to help another team member, if you have an attitude when somebody asks you something or corrects you, even if it's not me, if it's another team member, because they've been here longer and they know the way that it needs to be done. If you're giving a lot of pushback, that kind of stuff is counterproductive to what we're trying to do. You're lazy, if you're not here on time, when there's work to be done and like you're elsewhere, or if everybody's working and you're in the break room, like legs crossed, eating or on your phone, like everyone's working, there's stuff to do. What are we doing?
Yeah.
Why are we doing it?
That's interesting. So then, Bianca, how can you tell if it's pushback or they're trying to push for a new, different idea?
I always tell people I'm open to new ideas. Like I do not know everything. But I think when you're new, you have to learn the system before you try to disrupt the system, right? When you're new to a place, you got to be like, okay, this is the way that they've done it. And it yields certain results. That's why they're training me this way. Let me learn, let me get my bearings. And then I'm very open to people being like, hey, doc, so I know that you wanted to do it this way. However, do you think we could try this way? Because I'm finding that we're having certain hangups here. And I think if we pivot and do it a little bit differently, that maybe that can avoid some of the frustration and the hangups that we had. Because you're the one doing it at the end of the day. But if you don't actually know the system and know why we do it that way, then it's hard for you to make a suggestion. You may have done it differently someplace else, but no two offices are run the same, especially when people come from corporate. I'm like, you may have done that there, but you have a whole like back end team stationed somewhere else that's filling in the holes. We don't have that here. So this is why we do it this way, and just try it for me, please. I'm very okay with pushing for new ideas. I love that, but we got to learn like the basic system and policies first, and then we can be innovative.
Gotcha. So learn principles first, and then from that point on, you can create your do's and don'ts and the laws and all that other stuff, if it's worthy of it, right?
Right.
I like that. That's really good. So then if we pivot a little bit towards the virtual team member that you brought on that just started, how'd you find them? How's it working? What are they covering?
So I've been doing too much. And so one of my friends that practices in San Diego was like, hey, look into HelloRach. They're in the Philippines. A lot of them are doctors or other very educated professionals that need additional work. And it's pretty inexpensive. I think it's $9.50 an hour. They do whatever you need them to do. And I was really hesitant because I'm like, I don't know that I have 30 hours worth of work for this person to do, but I do. There's always like little tasks and I'm like, I don't have time to deal with this, or it's 11 o'clock at night and I'm working on something that I really need to get sleep. So I finally bit the bullet. I've interviewed some people. I actually hired her on 4th of July because they don't celebrate 4th of July. So I interviewed her. I was like, yep, you can start on Monday. She is doing some of our back office things. So verifying insurance and creating our insurance profiles and sending claims, going back for claims that haven't been paid on yet. And I've sat on the phone with insurance companies for 45 minutes, and that's not a good use of my time. And then doing some of our goal setting, going back through our practice management software, cleaning that out. I want to create a concierge membership plan for like busy healthcare professionals that we can come after hours or weekends to kind of give them the flexibility. She's creating that for me and compiling a list of doctors and professionals in the area so we can send out a letter. All those little tiny tasks is what I have her doing.
Interesting. So how do you combat with the notion of I'll just do it on my own, like an hour versus $900, right, that you're paying? Or did you even have that kind of conversation?
No, I did. I think for a while I was like, listen, it's not that much. I can just do it myself. But there's a lot of other things that I have to do. And it's $9.50 an hour for them to do it. They're more than happy to do it. I'm like, let's try it. If it doesn't work out, if there's too many mistakes being made, no harm, no foul. Like I resume doing it myself. But in researching other outsourcing companies, they were drastically more expensive. They're only going to deal with the insurance, but there's other things that I need help with too that takes the stress off of my team. And so it kind of made more sense to have a virtual assistant. They're on top of it.
The hour difference?
I have no idea. But she like was emailing me during huddle, like, I'm ready, I'm logged in, I'm ready to go for today. I'm like, okay, I have no idea what time it is in the Philippines.
Interesting. Okay, no, that's good that they're up and ready to do this. It's interesting because I know it's getting harder and harder for admin tasks. And I was just talking to someone before this, and they were saying how like they want to do less work, more pay, less work, more pay, less work, more pay, and
Period.
it keeps going up. Virtual assistants is where it's at right now.
Because it's hard to find staff. People want crazy salaries. I'm like, with what experience? What experience do you want $25 an hour? What are we talking about here? You hire them and they can't do the things, and then you're instantly resentful because,
Mhm.
we're paying you all this money. And as a startup, I'm not at the place where I get a regular paycheck. So if I still have to help you do your job and pay you, it
That's
doesn't
a
make
lot.
me happy. Yeah. Like, just to be like completely honest, like that doesn't make me happy. If I have to do it, I'll just pay myself to do it.
And you're paying that person more. So yeah, it's a lot of give and take. There's more benefits from that virtual assistant. It's gonna be interesting. It's gonna be interesting to follow up and see like month or years from now how they like kind of blossomed.
I'm hoping she's around for a good while.
Yeah, awesome. So then you mentioned the practice management software. Who are you guys currently using?
I use Oryx, which I absolutely love. Before, let's see, I used Dentrix and then we used Softent when I was an associate, and they're fine, right? But I felt like they were really old and kind of antiquated. I like cloud-based because I can be anywhere and be able to log in, text message a patient, or look at our schedule, move some stuff around. I like to leave at 5 o'clock. I like to pack up my stuff and go.
Yeah.
So when you're, on server base, you either have to have a remote desktop situation or you have to be in office. That makes me sad and I don't want to do it. I want to do my work from the comforts of my home. So that was one big push, but a lot of the other companies, they had a lot of add-ons that you had to like add on, a certain service for paperless forms and payments. And
Mm,
I felt like, okay, well, those prices for those third-party integrations are going to add up quickly. With Oryx, a lot of it is all encompassing. It's a very reasonable bill. And I also started doing Kois maybe about a year and a half ago. So John Kois helped develop Oryx. And so a
mhm.
lot of the principles and things that he taught is integrated into our software. So that made it very easy for me. And I feel like it's robust, but it's very easy to use. It's
Mhm.
very user friendly. And then it gives you a wonderful little report to give your patients at the end of the day when they're done with their comp exams. And I've noticed that's made a really big difference. It's like a little free marketing tool. Normally, like your treatment plan that has the little teeth on it and whatever the stuff is that we've diagnosed you for. But with Oryx, it gives you grades and it's color coded and it's like, hey, this medication can interfere with this. And we notice caries. So let's talk about X, Y, and Z. So it's very, very comprehensive. And when we can't get them to schedule and they're like, I need to think about it, or I need to talk with my spouse, they have the whole little packet of basically like their mouth report card, as I like to
Yeah.
say. And they can talk it over. And then when we call them back to schedule, they have their photos, they have their x-rays, they have their scans, they have everything in front of them. And they're like, okay, yep, tube number 3, that one that you said, let's go ahead and schedule that one. So I really like it.
Is your team able to use Oryx pretty well or no?
Yes, they are. And my
Okay.
team right now, other than my one assistant, have no dental experience. And they've been able to jump right in, make appointments, chart. It's very, very easy to use
Okay, that's good. You've been using it for how long?
since we opened. So 11 months.
Okay.
Yeah, I looked at other ones and I'm like, no. A lot of people have good things to say about open dental, and I don't dislike open dental other than the fact it looks like it is from the 1980s. I'm like, what is this Adonogram like looking thing? But I always liked Oryx.
In the beginning. Nice. Okay. So then with that, and you were talking about the report card marketing and things like that. Could you share some insights on which marketing strategies have really hit the mark for you and brought in good results?
We are still playing around with it, to be quite honest. We are very, very consistent on social media. So I have a local team that comes to capture content at least once a month. And we post reels and stories and interviews and patient testimonials and photos on our Instagram. I've been working with a company called King SEO Services out of Chicago. He's been going back through our website, adding more blog posts, increasing our search engine optimization. He's also doing some Google ads for us. And then I feel like I use the best website company there is, which is Studio 88. They build beautiful, beautiful websites and branding. And I love my logo. I love my brand. We get compliments on it all the time. So they built our website. As far as marketing goes, it's been robust. We kind of are doing a lot of things, but heavy on like the digital and social media marketing, because I feel like that's the way things are going. If I'm going someplace new, even on vacation, I've created a board on Instagram and I'm like using Instagram like Google essentially, because it allows you to see other people's stories from other people's perspectives and different photos at different times. For me, I was like, I have to use social media and digital marketing. It's a must because you can reach the masses. And so that's why we're able to pull patients from different cities as well.
Interesting. Okay, I like that. So then Instagram is your main platform on social media that you're utilizing.
Yeah, we're trying to do more TikTok too.
Okay.
TikTok is just like new. So I'm trying to like navigate that.
You have somebody who's in charge of the blog posts, SEO, Google ads, and then you have Studio 88, and they're just in charge of the website or the content, the photography, or what?
When I signed up with them, they come out and they do their initial photography. So of my team, unfortunately, many of those members are not with me anymore, which is fine. But of the practice, and we had some patient models and things of that nature. So they did interviews. I think we have 4 or 5 interview videos with them that is on our website, and they construct the website. So the main content for that. Then I have somebody that kind of does the back end work for my website and for Google. Then I have another marketing team that comes in to shoot our local regular content. So we have content day at least once a month. And we're like mic'd up and doing all kind of crazy stuff, whatever it is we need to do.
So if you don't mind me asking, from the beginning of it, how much of your budget goes toward marketing?
A lot. I think I spend roughly about $8,000 a month on marketing.
$8,000.
At least.
Wow. Okay. And then right now, currently, how many new patients are you bringing in?
I wish we were bringing in more. It can be anywhere between 15 to 20-ish. We're also a mainly out of network office. So we're not in network with everybody. And so that's a little bit different for our area. And it provides a unique challenge.
Yeah. Oh, yeah. Big time.
For us. Yeah.
How did you decide that, the marketing budget?
I did not decide the marketing budget. It just kind of was like, these are the things that I need. That's how much they cost. Alrighty then.
What to you was the biggest pill to swallow when it came to marketing?
How much marketing actually costs. Even to do like your content that you post on social media, how expensive that actually is.
Gotcha. So like the once a month guy, the once a month production.
All of it really is mind blowing to me. I don't even tell very many people. They're like, well, oh, your marketing's so good. How much do you spend on? I'm like, you don't want to know. You don't really want to know. I find that it's important. And there's people like I'll be at a store or even like my mom will be like at the beauty shop and they're like, oh, I've been following your daughter on social media for like months. And she's like, really? All right, I'll let her know.
Yeah.
So it's impactful. So it's worth it. But I didn't decide the amount. It was, we need somebody to do this. This company is not great with this. Let's find somebody that's great with this. Okay, I know that I'm not going to run around with the tripod all day, like trying to like record things. So we need to bring somebody in that can do it and edit it. So that's how we end up with the budget that we end up.
Good information isn't just content. Good information is impactful. So if it's impacting people's lives, it trickles down. It's a long game.
Correct. A lot of it is brand awareness and people constantly seeing it when they open up their apps and when they're scrolling online and all of that. Then they're like, you know, I am looking for a new dentist. I do need a cleaning. Oh, yep, this tooth does hurt. And there you are. It is a long game.
Could I ask, why did you go with Studio 88? I know you said they're the best, but like you hear a lot of the times they're one of the most expensive.
Very on brand for me. The truth. I felt like they were the only company that really understood my vision. I wanted an elevated experience. I wanted it to feel boutique. I did not want a picture of a tooth as my logo. Like I needed it to be a little bit more, and they got it. And they're super duper helpful. There's no regrets with them. Yes, they are more expensive. I love my website and I love my brand. I don't feel like I need to change my logo and my brand and my website, you know, a year in, because it's not something I really loved.
Yeah. Were you in between oh, this company or that company? If so, what
I
was the other
was,
company?
but nobody touched their websites. Nobody touched their branding. And for me, that was important. I view a website like a wedding invitation or like a party invitation. It sets the tone. If you
Mm-hmm.
receive an awesome invitation and it's fancy and it's nice and it's on glass or it's in a little box or whatever, you know you have to come correct for the event. Get your outfits together. Like you got to come correct because this is an event you don't want to miss. If this is the invitation, I view my website like that. When people click on it, I want them to be like, yep, that's the vibe that I'm looking for. I don't expect them to be the cheapest because it doesn't look like they're going to be the cheapest, but I expect quality. I expect this boutique type feel. That is my invitation, is my website. And so I felt like if that meant that I had to pay more for it, and we do not have a tooth as our logo.
Your logo is what?
It is actually a peacock feather, like the innermost
Ah,
part of a peacock feather. Yeah.
interesting. So that was part of the vision, meaning what?
It was part of the vision. So I did a post-bac program in San Francisco. The purpose of the program was really to increase diversity in dentistry. This is a white guy, blonde hair, blue-eyed white guy that was sick of dentistry being like all male, all white. There has to be diversity. There's so many underserved groups out here. And how do we connect with them if they don't ever see themselves as a provider? And there's a video out there, but his motto was be the peacock in a room full of penguins. And penguins, he related to dentistry being mostly male, mostly white. And our mascot, if you will, was a peacock. And he's like, you guys are from all different races, all different backgrounds. You add that life and that color. Be the peacock in every room that you enter. Be the peacock in a room full of penguins. So I've always held on to that. And so I want my practice to be unique and different and be the peacock in a room full of basic general dentist office or your regular general dentist office or your regular corporate office. It's meant to be different. I'm different and my
Hmm.
practice is meant to be different and it's meant to feel different. And we treat our patients differently. So that's why our logo is a peacock feather.
Yeah, to be different. Nice. I like that a lot. That's really good. Be the peacock in a room full of penguins. So, throughout the 11 months, can you recall like a month where it was like, oh my gosh, it skyrocketed this month?
I think December and maybe like March, I was just like, where are these people coming from? Call for call, new patient. I'm like, what's happening here? We're not running any digital ads. Like, where are these people finding us from?
What was happening in those months then?
I have no idea. I think end of the year, people are like, oh, I have these benefits. I need to see someone. And that was great. I'm not questioning it. But there hasn't been any startups in our area for years, like 30 years outside
Hmm.
of like corporate. So I am the first startup in a really long time. And so people are just now realizing there's somebody else in town, but those older dentists are retiring. They're selling their practices to corporate, and people are not liking the ways of corporate. So they're looking for other options.
Okay. Did you guys ever like dive into March or your marketing or maybe ask Studio 88 or the other guy, let's dive into March and let's dive into December, break it into pieces to see exactly what's happening?
I think that's a really great idea. And I think I will have them do that. I think we will do that. That's actually a fantastic idea. I was running some Facebook ads, but they can be kind of hit or miss. So I kind of like stopped because people are like, hey, do you have a grant for free implants? I'm like, that's not a thing. Where are you getting this from? I know you do this on Facebook. We're not running that ad. But yeah, I think we will. I'll ask them to look into that.
So then throughout this time, from the moment you did your startup to now, besides the companies we mentioned, what have been some of the best companies you've worked with and then some of the worst or ones that just didn't fit your vibe?
I think honestly, and people complain a lot about these big dental supply companies, Henry Schein, Patterson. I love my Henry Schein rep. I love him. He is amazing. He's going to come by the office every other Tuesday afternoon just to be like, hey, do you need anything? Anything broken? I think I emailed him, I texted him at 10 p.m. on Sunday, and I was like, hey, we're running low on like a list of things. And I'm like, we need it for patients next week. And he's like, okay, doc, not a problem. I'll go ahead and submit the order. Love him. I never have to worry about quantities. He's not going to over order. He's always going to try to find me a deal, a little coupon. I appreciate it. Love him. I feel like most of our vendors, we've gone through a few different marketing people, but I think that's just the nature of marketing. You got to find like the right fit. And as you move through phases
Hmm.
of ownership, people serve different purposes. But for the most part, like I used Ideal Practices to help me open my office, and I still do consulting with them. They've been fantastic and wonderful. I love my startup MBA advisor. She is like my second mom. I can text her in the middle of a breakdown and she's like, it's going to be fine. It's all right.
Yeah.
Like, come up with a plan. Okay. Love them. But I feel like all of our vendors and the people that I've selected, I'm a very intentional person. So in selecting people to work with, if the vibes are off on the first meeting, there won't be a second. You'll be very lucky if there's a second.
Mm.
But for the most part, I'm really happy with the people I've selected to like work with.
You know what, Bianca? It feels like you're like, I know myself. I know what I need, my direction, right? You have that. So it's not like I'm new. I don't know if this should work. Let me just give it a shot. And then you're stuck with them for like a year and you're like, I thought this was how it's supposed to go. But really, you kind of knew this whole time. You're more direct, which is good.
My dad taught me that. He was like, listen, when you go buy a car, you need to know as much about the car as the salesperson. They should
Mm.
not be able to tell you something that you don't already know because they're hoping that they can so that they can upsell you on the fanciest whatever, whatever, whatever. And you fall in love with that of this hope and this dream that they can give you instead of knowing like, this is what I want. I already know that it's a V6. I already know X, Y, and Z. And they know that they can't BS you because you've done your research. So that's kind of how like I live my life. So when I'm like researching technology or I'm researching a company, like I've looked, I've read, I've contacted clients that you may have. I've already done all of that.
Hmm.
And so you don't need to sell me anything. I just need you to hear like my vision. How can you help me get there? That's all I need. And how much are you going
Hmm.
to cost?
And then that's it. And then even
Yeah,
then, sometimes like budget, you just want
right.
it, the thing.
Yeah. Sometimes I'm
Okay.
like, yeah, this is too expensive. I can't do it right now. Love to, but can't do it right now.
So you put a pause on it. Okay, interesting. So then if we real quick rewind just a little bit, you mentioned everybody that Studio 88 came to record, that team is no longer with you anymore.
There's only two team members, but
Okay.
yeah, it happens.
They left or
One person like left one day and that was it, and then filed for
uh,
unemployment. I was like, are you kidding? All right. If you want to play those
yeah,
games, I'm your girl.
they just left completely?
Yeah. No words, no, I'm not
Mm.
happy, no, nothing. Which honestly, they were going to be out of here anyway. I knew it. It was me honestly dragging my feet, right? It was
Mm.
me not wanting to cut them loose because I'm like, this person does our insurance and admin stuff. I'm like, I don't know how to do that stuff. So they provide like a service and it's taking one thing off my plate, making a mess of it, things not being paid. And I learned how to do it and it's been fine. It's not the
Mm.
first person. The first person that I let go of didn't make it through like the second day of training, causing drama. I'm telling you, the vibe was off. Gotta go.
Yeah. So the first person vibe was off, second person just completely left.
There was a person before that, couldn't do the job, said that they
Um,
could, but clearly could not. And she knew she wanted to do a good job. But I was like, girl, you lied. You lied. And it's
mm.
showing the insurance stuff isn't right. We are having to write off things. And I'm like, we cannot write off things. Do you want to get a paycheck? We cannot write off things for cleanings because you don't understand. This isn't the job for you. And then one person left. And then I had an assistant who wanted more money, but couldn't do more. And so I was like, well, that doesn't make sense. So we can part ways.
Gotcha. So the assistant, did she tell you like, oh my gosh, there's my family or this and that, or
She just said that she needed more money and she was working part time someplace else, retailer, like at a coffee shop. And that's fine. But I'm like paying her hours anyway, because she really wasn't working. Like I was finding stuff for her to do. Even then, I'm like, let me add additional hours to her paycheck. And like when people don't even realize you're doing stuff like that and are appreciative of it, and there's basic things throughout the day you're not doing for me that you should be doing, and
Mhm.
you want more money, I have no problem paying you more, but you have to do more.
Yeah. Yeah, no, that's true. In order for us to have these crucial conversations, they become bigger conversations because of that lag time. We should have done it here, but we waited this long to do it. Now, this might be an argument.
It becomes like okay, we're going to go our separate ways. But I mean, I'm very honest. I'm like, listen, as a dentist, if I want to earn more money, I have to do more to earn that money. If I want to keep more money in my pocket, then I got to do the cosmetics. I got to do the implants. I got to do the things that insurance can't nickel and dime So I have to invest to do the training and I have to do more in order to have more. Honestly, that's the American dream. If we want to be completely honest, those that do more for the most part have more. And
Mm,
so I'm more than willing to compensate people and I will give you a raise and I will give you all the praise, but you have to do more. You
yeah.
can't do the bare minimum and want more. And I think that employing people these days, that's their mentality. They want more for doing less. And I'm like, that's not where we're at.
Yeah, no, you're right, 100%. So then throughout this time, throughout those 4 to 5 previous employees, what have you like learned and pivoted a little bit more or changed?
One thing I'm really proud of myself is that when people aren't the right fit, just letting them go. There was a couple of people that I held on to too long because I was like, what am I going to do if they're not here? It's going to be more work for me. Well, I was always already doing most of their job anyway, but let me reduce my frustration. Let me reduce my annoyance. Getting people out of the way that are not helping your business or helping you grow stunts your growth. And it also prevents you from looking and hiring the right people. So our better production months, it's actually been me and my intern. And we've been a 2-woman show running a whole office and have had better production months and getting more people scheduled and less things falling through the cracks because we have 2 people that are really dedicated to each other and to the business and to our patients. And we're making it work until we found additional team members now that we can bring in, train, and they can come into the fold and help us. So I think it's more so when you realize people aren't the right fit. Yeah, you may need help, especially if you're a young dentist. Like you remember in dental school, you didn't have a dental assistant. You can do things without one if you can't find like the right fit and not being afraid to get your hands in there to learn, to try. Like I'm not going to be mad at myself if I mess up an insurance claim and I have to write something off. My bad. I'll learn that. But I will be mad at somebody who says they have insurance experience and they've screwed something up. I think that a lot of business ownership is getting in there and like learning yourself. And when people aren't the right fit, let them go.
Okay, I like that a lot. And then last question, what's one piece of advice you'd like to give someone who's about to or thinking of doing their own startup?
It's hard, but do the hard anyway. It's yours at the end of the day. You don't have to worry about a lack of transparency. You don't have to worry about a discrepancy in your pay. You don't have to worry about poor systems. If the systems aren't bad and you're frustrated at the end of the day, you have the power to fix them. If you don't like certain type of insurance, you have the power to change it. When you're working for other people, you don't have that. You're an employee as well. So you just are into the fold with everyone else. So it is hard. I see people and my friends that are like in Italy this summer, and I'm like, all right, but it's something that's mine. And it's different when corporate puts your name on the door. They can let you go and they'll scrape your name off the door the same day. But this is yours. And so it can be whatever you want it to be. It is very scary. Every day is a little bit of imposter syndrome. Can I make this work? How am I going to make this work? Where are the patients? How am I going to pay bills? All of that. But do the hard anyway.
I love that. Awesome, Bianca. Thank you so much for being with us. It's been a pleasure. But before we say goodbye, can you tell our listeners where they can find you?
Oh, yes, we are Bellissima Dental Boutique. We're in Fayetteville, North Carolina. You can find us on Instagram at Bellissima Dental Boutique. Same thing for Facebook and our website, www.boutiquedentalandimplants.com. So yeah, reach out if you have questions, if you want to do a startup, not sure if you want to do a startup, acquisition. I'm an open book. I'm your girl. Reach on out.
Awesome. So that's going to be in the show notes below. And Bianca, thank you for being with us. It's been a pleasure, and we'll hear
Thank
from you
you.
soon.
Of course. Thank you so much.